I'm Dr. Virgie Braid Ellington, and this is another episode of What Your Medical Debt Doctor Wants You to Know. And this week, again, we're talking about the medical billing mistakes of the week, or the medical bill paying mistakes of the week that I'm starting to call it. I'm starting to say, you know what, this is actually what it is, because you've heard me say in past episodes, the providers aren't making mistakes. They know what they're doing. I call this segment medical bill mistakes of the week, because 80 to 90% of every medical bill in the United States have errors. And if you can imagine, they're not going to be in the favor of the American public, of the patient, right? It's going to be in the favor of the providers and or the insurance companies if you have insurance. So that's why, you know what, over time, I've come to the point where it's not a mistake on their part. It's a mistake on our part, the patient's part, because we don't know any better. And the providers, the billers and the insurance companies, if you have insurance, they know what they're doing. The mistakes are ours in terms of paying it, because we don't know any better. And that's why we're here today, Crush Medical Debt Nation, to make sure that we arm ourselves with information so it doesn't happen to us. And if we're already in debt, what to do to get out quickly, and to figure out, hey, do I really owe this? Maybe not. Unfortunately, way too often, no. And like I like to say, I call myself the lady who got out of paying a $90,000 medical bill. You can too. And let me show you how. It's much easier than folks think. It's not too complicated to make sure you're not getting overcharged, you're not overpaying your medical bills. Go back and revisit an episode last month where I talked about the medical bill paying mistakes of the week, a particular case where I talk about the difference between screening procedures and diagnostic procedures, and that under the law, federal law, the Affordable Care Act, ACA, Obamacare, whatever you want to call it, by federal law, it's been in place for some years now. If you go to healthcare.gov/preventive services, and we'll put it at the bottom at the end of the episode, go on there, and those, if you have insurance, those procedures, if you have private commercial insurance, those procedures that are listed there as screening preventive services are covered with no patient sharing costs. They're totally free to us, the American public, if we have this any private commercial insurance overseen by the federal government. And what that means is no copay, no co-insurance if your insurance plan has co-insurance, and no deductibles. So it's great stuff, but many of us don't know that by law, it's free to us. Certain of these screening procedures are free to us. So screening colonoscopies, screening mammograms, screening pap smears, depending on the age and your background, your risk factors, it's free if it is screening, meaning you don't have any symptoms, you're just doing routine health maintenance to make sure there's nothing there hiding before it becomes a problem. So I was talking about this in this last episode of What Your Medical Debt Doctor Wants You to Know, or medical bill paying mistakes of the week. And I was sharing my story, and one too many providers, I don't want to say the system, but one too many healthcare providers make mistakes. And I'm going to say in this case, it probably is a real mistake, because even though Medicare, CMS, Centers for Medicare and Medicaid Services, have said over and over again for years since the ACA has been in place, the laws in place, that if you have polyp removed during colonoscopy, or if the person has had a history of something but is now asymptomatic and you're just doing routine screening, it is screening. It's still screening. It doesn't matter if you had a polyp taken off during a screening colonoscopy. Just because they found a polyp doesn't mean that it's diagnostic, which many providers will say. So I was sharing my story. In my case, I was told, like many women are told who have a history of breast cancer, that, well, you've had breast cancer, you have breast cancer, even though it was treated, you have breast cancer until proven otherwise. And this is no longer screening, it's diagnostic. And I was sharing my story, and I admitted that, and this is back in the day before I knew better, like the American public, 99.9, I'd say, percent of us know better. The ACA was in place at that time and that the screening mammogram was covered for free. And I showed up and they asked for $200 before they would do the mammogram because they said it's diagnostic and not screening. And I had shared that I was really angry and frustrated. And I called my provider to have her clarify that the requisition, which is the form that you bring to a facility, imaging facility or radiology facility for the mammogram, in this case, a mammogram, that just to make sure, confirm that the requisition says screening. And she said, yes. I got her on the phone and she said, yes, it's screening. Virgie, it's screening. Yes. I said, yes, I know it's screening. Why these boneheads, these hood rats? I was really being really nasty, talking about them right in front of them, knowing that they could hear me and I didn't care. And I wanted to address that. And I shared that. My husband pulled me aside and said, look, Virgie, you can't call people, don't call them names. You can't do that. They can do things to you. And I'm like, no, they can't. Bring it. Let them try, And I'm laughing, again, I laugh a lot, so I don't cry. And that's because I know that these things I can handle. It's not going to make the difference if I'm going to be able to make my rent payment, my shelter payment, feed my kids, keep a roof over my family's head. But for many, it will. That $200, I put it on a credit card because I don't carry cash. But that $200, that was another case I was sharing, that $200 really will hurt somebody, many people, and they'll put it on their credit card because they're not part of the crushed medical debt nation yet. And they don't know that we don't put our medical bills on credit cards. We don't put medical debt or mix it with consumer debt because we have special protections by law that protects us from problems if we get into trouble with medical bills and debt. So anyway, I'm laughing. When I laugh, it's because, I'm really laughing so I don't cry because it is a very serious issue. Again, medical bills are America's #1 cause of bankruptcy, debt, and stress, period. So anyway, I shared this story and I just want people to know that it is not okay to be nasty to folks in the front line. And I talk about this in my book, What Your Doctor Wants You to Know to Crush Medical Debt, or I just call it Crush Medical Debt for short. In Crush Medical Debt, I talk about that. Please be kind, polite, and patient with the folks that you're speaking with by phone or in person when you're at your medical care facility. The folks on the front line, really, believe it or not, they want to help you. And if they're not able to help you, or they don't seem like they're willing to help you, it's because they can't. Why? Because they haven't been trained. So these receptionists who are saying, you owe us, you got to pay this, it's your requisition, even though it says screening, you have a history of breast cancer, that means that it is not screening, it's diagnostic. They are doing their best. They've been trained in the steps and how to bill, take information in, and bill appropriately for it. So it is not okay to, even though I wasn't yelling at them, I wasn't calling them names to their face, I was standing by their desk and talking very loudly so they knew I was talking about them, that their procedures were wrong. Well, Virgie, that was not helpful or productive. In 2016, the 2016 Virgie, the 2016 Dr. Virgie did not know that, well, you know what, this is the way they've been trained. They don't know any better. And this is the way they've been trained. And so as the public, the average American patient, I would say 99.9% of us, we don't know either. I didn't know. I knew that something was really wrong, but I didn't have the information to be able to protect myself and say, no, this is why you're wrong. All I could say was, you're wrong, but I couldn't tell them why. I didn't have that information at the forefront of my brain, right? Now we do. But I just wanted to say, somebody brought up, well, were you really mean to them? I was like, well, in retrospect, yeah, I was really mean to them because they can't help it. And even though, again, I was not yelling at them, I was not directly talking to them, I didn't call them names to their faces. I was talking very loudly about how I said, you know what, they're really ignorant. This is really stupid. This is not what do I say to them and tell them this is not diagnostic? It is screening. It's a screening mammogram. So I just wanted to clarify that it is not helpful and productive to get upset with the folks that are on the front lines that are trying to help us. That's the way they were trained. We're going to come to them and say, well, no, this is wrong. And if we don't have the requisition in front of us, we're going to stop everything and we're going to call the provider, like I did. But instead of doing what I did rather, and get upset and say, you know, these people are stupid, you know, la, la, la. what the age, you know, whatever, you're going to politely ask for your physician and or the medical office manager, your provider's office manager or representative, and ask for an ICD-10 code, basically a diagnostic code that says this is a screening procedure. If you have that information and get it to the provider, the folks in the front line, the representatives, the provider where you've been sent for your screening service, then they can take that. They know what to do with that. They can take and say, okay, well, yeah, this is screening. So that's what you do. How does it go? Do as I say, not as I do. Again, the Dr. Virgie of 2016 didn't know any better. And many of us, and the facilities, unfortunately, are counting us not knowing any better. But Dr. Virgie and the Crush Medical Detonation, we know better. So, but even so, even if you're not sure, you know something is wrong, listen to your gut. Just be polite, always be polite. It's not helpful or productive to say you're wrong, you're wrong, you're wrong, and you're stupid. That's not helpful or productive at all. It's not going to get any of us anywhere. And again, you know, you can catch more flies with honey than vinegar, right? And I always go back to the underlying, we're all in this system of things together. And for the most part, people really do want to help each other. If they don't, it's because they don't know how. They haven't been trained. And this is the way the system has trained, I would say, the overwhelming majority of folks on the front line and the receptionists, the billing staff. This is the way they're trained. They don't know any better. We do. And with gifts, the gift of knowing better, we have responsibility to patiently educate them. If you don't get a response from the person you're speaking with at the front lines, ask to speak to a supervisor or a manager. Keep escalating it politely and saying, look, this is why it's wrong. This is screening, not diagnostic. I'm calling my doc for an ICD-10 or a code. I'm calling my doc for the documentation to show that this is screening, not diagnostic. And I don't owe any copay, co-insurance, or deductible. So I just wanted to clarify that. Always, always, always be nice. We're all in this together. Let's be kind to each other. You know, none of us know what demons we're struggling with. You know, let's be kind. You know, we're all in this system of things together. None of us are going to get out alive. So, you know, let's take care of each other while we're all here, right? So the first case issue I want to talk about this week in today's episode of medical bill paying mistakes of the week. I'm still calling it that instead of medical bill mistakes of the week, because it's up to us to protect ourselves to not unfortunately in this for-profit U.S. healthcare system, we have to protect ourselves arm ourselves with knowledge to not get taken advantage of and not go into debt or not have our financial futures or worse, not have our financial futures completely devastated. So we're going to learn the number one way, let me back up, the only one right way to pay a medical bill, which involves 3 steps. And we're going to learn the rights that we have as patients, American patients, by law, by federal law. So this one, these cases are a little bit, I'm going to say they're a little bit more confusing than the even average confusing issues or things about medical care bills that people find confusing in this country, in our for-profit system. And that is ambulance services. So ambulance services are a different breed because the many regions don't have ambulance services. And so many regions, areas of the country. So there are volunteer ambulance services in some communities, in some areas. The other thing is that because they're not, there's no real structure in place in the U.S. system for ambulance services to be taken care of, they don't have the resources and guaranteed resources that many other institutions have, like our nonprofit medical care institutions have, let's say. So they also have been, because of that, they were carved out of the No Surprise Billing Act, or No Surprise Bill Act, that got passed and went into effect as of January 1, 2022. They were carved out. Ground ambulances were carved out of the requirement, if you have insurance, even though the service provider is out of network, if you have insurance and the service that you were provided, medical care you provided, they don't take your insurance or out of network with your insurance, they don't have to negotiate. Unlike ambulance services, unlike the other providers, including air ambulances and other providers have to negotiate with your insurance company directly and take whatever your insurance pays for a typical service, same service typically that they pay for in network, and accept that. And if they disagree, they have to work it out between them and leave you as a patient out of it. That's what the No Surprise Bill Act says. This is the thing. Ground ambulance services have been carved out of that. And I have to tell you, they do some really, really just not cool things in terms of billing, because, I always say this, never hate a hustler, don't hate the player, hate the game. But sometimes I'm just like, really? So in my experience, and I talk about this in my book, Crush Medical Debt, there are ambulance services who will send you a bill directly. They will send it to your insurance, maybe, sometimes not. So always three steps of the one right way to pay a medical bill, step 1, 2, and 3. You apply that to every bill, including ambulance bills, to make sure if you have insurance that they applied it to your insurance first. But step 1 is critically important with every bill, and particularly with ambulance services, because the CPT codes that describe ambulance services are really, really important. And it makes a big difference in terms of, what you're going to be billed, if it's 3 figures, like a few $100s versus a few $1,000s. And that's why we have to apply definitely step 1, but the 3 steps of the only one right way to pay a medical bill to every single medical service that we receive, a bill from medical service we receive, especially ambulance services. And in this case, there was, this is July 27th in KHN, Kaiser Health News. This was their bill of the month. And the title is called "The Ambulance Chased One Patient into Collections." And so the subtitle is, after accepting an ambulance ride after a car crash and being seen in an emergency room, this person was billed more than $3,500, more than $3,600 in ambulance fees by a taxpayer-funded municipal fire department. So in this case, she lived in a region where they have an ambulance service that is funded by the community taxpayers and is affiliated with the fire department. And she says, in retrospect, she says she shouldn't have taken the ambulance. She was the least injured of the 3 siblings who were in a car. She was one of 3 siblings who were in a car when it was struck by a pickup truck. And somebody called an ambulance. She called her daughter to tell her what happened, what's going on. And her daughter had offered to say, come to pick her up. And she says, in retrospect, I should have done it. Her sister and brother, this person's brother and sister, were more seriously hurt, and they were taken to the hospital in 2 separate ambulances. So while she was standing there after her brother and sister were taken away because they were seriously injured, she was just a little stunned, but she knew that she wasn't hurt. And she was standing around, and the ambulance driver told her it would be a good idea for her to get checked out too. And they wanted to take her to the emergency room to get checked out. So she wasn't hurt. She had just a bruised sternum because she was wearing a seatbelt. Her sister, who wasn't wearing a seatbelt because she was in the back seat, ended up spending 5 days in the hospital with a brain bleed, a cracked rib, and a bruised lung. And her brother also had rib fractures. So she's thinking, you know what, they're all fortunate to be alive. And she was fortunate that she dodged major injury until the bill came. She and her siblings were all charged for the same service. When they compared their bills, she got her bill for more than $3,600 from the ambulance service. She compared her bill to her siblings' bill, and all 3 siblings were charged for the exact same service: Advanced Life Support Emergency Level 1. That's code for transportation by a ground ambulance in response to a 911 call, and it can include medical services as simple as an assessment. All 3 were also charged a mileage fee. Now, this is typical, usual. The ambulance will bill for the code level that they feel is appropriate for the services provided, and they also will charge a mileage fee. So makes sense. This person was billed for 14 miles to the nearest emergency room they were taken to. Her sister and brother were billed for 15 miles. But apparently each of the 3 siblings rode in separate ambulances, each from a different nearby district. So they were billed 3 different amounts. Her sister, who was injured the most and really seriously injured, was billed $1,250, and that includes the mileage. It was $1,100 for life support and $10 per mile. Her brother, who was second to the least injured, he wasn't very injured, only second to the patient in the story in this case. He was billed more than $1,400, $1,200 for life support and $10 per mile. Now, mind you, they didn't get any life support services, but that's the way it's described in writing, and we'll get to this later. I didn't see any CPT codes. Did I see CPT codes on this? And they share a picture of the bill. Yes, they did. In this case, and I'll talk about that, they did, which is helpful, which is why we have to apply all 3 steps. That first step is critical with every single bill. Get that CPT code for every service you've been provided, or that they're billing you for, that they're saying that they provided to you. So they're saying life support, they're calling it life support, just general description. This just may be the journalist way of saying it, but $1,100 for the sister for life support, $1,200 for the brother for life support. The person in the story, in the center of the story, who was billed more than $3,600, was billed for more than $3,100 for support services and $30 per mile. Wow. So in this case, this journalist shared, in telling the story, said, private for-profit ambulance companies have been notorious for pricey bills for the reasons that I described. But in this case, this woman and her siblings were being billed by taxpayer-funded emergency services or ambulance services supported by taxpayer-funded fire departments. So their question was, well, why does the charges for the exact same services vary so widely? And the answer is, someone who does research in this work, Dr. Karen Chabra, a surgical resident at Brigham Women's Hospital in Boston, a former research fellow at the University of Michigan, published in the journal Health Affairs in 2020. They looked into surprise ambulance bills by looking at a large national insurance claims data from 2013 to 2017, and they found that 71%, which makes sense, of ambulance rides were out of network, meaning the insurance companies are not bound by a rate that's negotiated by the insurance companies. They're not in network. And local fire departments usually decline joining local insurance networks. This person, Dr. Karen Chabra, said the simple answer is these bills are all made up. And she says, and in this case, often it's the municipalities that are sending some of the most staggering bills and often pursuing them in really aggressive ways. And indeed, in this case, they sent this person's bill to collections. She tried to negotiate with them and say, look, she gave them a copy of her siblings' bills, like why we had the same accident, we went to the same location, and I was hurt the least. What's the difference between this? My insurer pays the quote unquote usual and customary rate, which was $400. And she was on the hook for the balance, because it's not a balanced bill if it's not a balanced bill if the provider does not participate in your insurance, then it's not a balanced bill. They can say you're responsible for the rest. And so she responded, she challenged the bill with the billing services, and she documented her siblings and what they paid. She says, I'm willing to pay, in addition to what my insurance paid, what my sister, who was hurt the most, was being paid or charged for the exact same service, and what she paid for the exact same service, the exact same ride. And when the journalist reached out to the billing services, the paramedic billing services administrator, vice president in this case, she said, well, you have to dispute charges directly with the insurance company. We're just the billers with the ambulance service. And she said, well, she did. She tried to call the ambulance service directly in addition to the billing department. So to demonstrate, they ignored her, and she said, you know what, I'm just going to send $20 to the billing service just to show in good faith that I'm trying, but you guys I haven't heard anything. I'm not ignoring you, but this is an outrageous bill and it's not accurate. Clearly it's not accurate. It can't have any representation in truth. She got a letter back with a coupon book saying she needs to set up a payment plan for the full amount. And I can't see how many months later, but soon after, she was sent to collections. She got a letter from a collection agency saying she owed more than $2,600. So their takeaway from this, Kaiser Health News, was sharing the story to say, look, the takeaway is getting into an ambulance involves financial risk. Your health may demand it, but your wallet may suffer. So understand your options. Obviously, if you're seriously hurt in an accident, you have no way to figure out whether the ambulance that shows up is in your network or not. But if they say, maybe if you feel well, just a bit banged up or with a laceration from a car crash or a fall from a bike, remember this. You do not have to get in just because an ambulance rolls up. They arrive because they've been informed of an accident by police or because someone has called or a bystander has called 911. And that's very true. But what happens if we don't have any choice in who rolls up, zero choice. And that's even if we're conscious, right? If we're severely ill or unconscious, we don't have a choice. So we get a bill down the road. In this case, I want to talk about how I would approach this particular bill, this particular problem, this particular medical bill mistake. And again, they didn't make a mistake. They know what they're doing. The provider, in this case, the ambulance service, they know what they're doing. But it's a mistake if I pay it because I don't know any better. But again, we're Crush Medical Debt Nation members, so we know better, and we're learning how to protect ourselves and not get overcharged and not overpay and not pay for something that we don't owe. So again, this is a little tricky because ambulance service categories are a little tricky. And I'm just going to go through basically the different categories, the major categories for ambulance services, because it makes a difference in how we would approach this case. So the ground ambulance categories, remember, by the way, ground ambulance applies to land and water transportation. Again, this discussion does not apply to air ambulance, as you're lifted out by helicopter or plane, there are protections under the No Surprise Act as of January 1, 2022. But ground ambulances, as I mentioned, are carved out. You're not covered. And just to talk about, just briefly, the reasons why it's not covered, why it was carved out, is because there is no national system, really, ambulance emergency transport network in the United States. So, they just catch as catch can. They just have to hustle and figure it out how they're going to get paid. Another story for another day. But they lobbied, therefore, and were successfully lobbied and were carved out of the requirement by federal law of the No Surprise Bill Act. So you get lots and lots and lots of outrageous stories about surprise bills from ambulances and ambulance rides and services. So I'm just going to talk about basically for most of the country, there's 6 basic ground ambulance categories. There's a 7th, but that just applies to ambulance services in New York State. It's called paramedic intercept. So I'm not talking about that. I'm just going to focus on the 5 out of 6 ground ambulance categories. 1, basic life support, or BLS. Then there's 2, basic life support emergency, BLS emergency. 3, advanced life support, ALS, level 1. 4, advanced life support ALS level 1 emergency. 5, advanced life support ALS level 2. And 6, specialty care transport. So what are the definitions of this? What does that mean? BLS versus emergency, BLS versus BLS emergency, ALS level 1, ALS level 1 emergency, ALS level 2. What does it all mean? What are the differences? So I'm going to just focus on, in this case, the CPT code. In this case, I actually got a real bill with CPT codes. They were billed for ALS emergency. The CPT code for ALS emergency, let me refresh my memory here. And then there's a separate code for mileage. So she was billed, she and her sister and brother were all billed ALS emergency level 1, and that is CPT code A0427. So what does that mean? BLS emergency versus ALS emergency, level 1 emergency. There's ALS apparently level 1 and ALS level 1 emergency. I didn't know there's a difference between those two, but anyway. So let's look at the difference between the definition of emergency response. So there's BLS emergency, ALS level 1 emergency. Let's just call it ALS emergency as opposed to ALS level 1 and 2. BLS emergency, basic life emergency support emergency, ALS advanced life support emergency level 1. Emergency response has its own definition, which means that the definition is emergency, whether it's BLS or ALS emergency. Emergency means in a BLS or ALS 1 level of service has been provided in immediate response to a 911 call or the equivalent. An immediate response is one in which the ambulance supplier begins as quickly as possible to take the steps necessary to respond to the call. So what's the difference between, so that emergency response applies to BLS and ALS 1. Advanced or basic, doesn't matter, same thing. So what's the difference? And the next question is, okay, well, if they were all charged for ALS, but one of them at least received minimal at best BLS services, well, what are the differences? How would you describe the definition of ALS versus BLS? So the definition of basic life support is transportation by ground ambulance vehicle and the provision of medically necessary supplies and services, including BLS ambulance services as defined by the state. The ambulance must be staffed by an individual who is qualified in accordance with the state and local laws as an emergency medical technician basic, EMT basic. These laws may vary from state to state or within a state. For example, in some jurisdictions, EMT basic are permitted to operate limited equipment aboard the vehicle, assist more qualified personnel in performing assessments and interventions, and establish a peripheral intravenous or IV line. Okay, so what's the difference between that and advanced life support? Advanced life support level 1 is transportation by ground ambulance vehicle and the provision of medically necessary supplies and services, including the provision of an ALS assessment, and at least one ALS intervention. An ALS assessment does not necessarily result in determining that the patient requires an ALS level of service. The determination to respond emergently with an ALS ambulance must be in accord with the local 911 or equivalent service dispatch protocol. Okay, so it doesn't, you have no choice, obviously, as to who gets sent out, BLS or ALS. And they can't determine that when they get a call for a car accident. I totally get that. But there's a difference in the services that are provided. So the assessment that was done by ALS and the intervention is determined based on the EMT's assessment. Okay, but in this case, even though it was an ALS level ambulance and service that was sent out, what was received was not ALS level 1 services. This person she didn't even need an IV line, and she did not need any assessment. So the way I would handle this, and this is where I'm going with this, the way I would handle ambulance service CPT codes, if I were walking and talking, they just said, hey, you want to go for a ride and get checked out? And I said, yes, let's go for an expensive ride. I'm game. I don't have a car. I can't drive. My car is wrecked. Yeah. Or I'm way away. I don't have anybody to come pick me up. Yeah, I'll go for a ride with you. Then I'm just hanging out. No need for an IV placed. Or any intervention, period. And I get a bill for ALS level 1 emergency as opposed to basic life support emergency. And it's an outrageous bill. Like in this case, this is clearly incredibly outrageous. I'm going to say, you know what? This falls in the category of services that I did not receive. That's the way I would argue it. I would file it with documentation, and I would send it to the ambulance service, their billing department, and I would consider sending it to your state's Department of Health. State Department of Health are the ones that are usually provide oversight of hospitals, but given that state to state, the jurisdiction in terms of oversight of medical services are different, that's why I would handle it. I would send it to them, some copies to them. And I would say, I did not receive ALS level services. My services that I received, even though it was an ALS equipped ambulance and staff, I received BLS services at best. I received BLS services, period. I owe the mileage, no problem. But I didn't get ALS services. I didn't need ALS services, and I did not get them. And this is the point. The number one thing that a provider can do to get into trouble is to charge for a service that they did not provide. Let me say it again. The biggest thing that a provider can do, a medical provider in the United States of America can do, is to charge for services that they did not provide. That goes straight to, without using the word fraud, that's what they're at risk of being accused of really quick. So that's the way I would handle it. I would say, look, I owe you for the mileage, but I think I owe you for BLS level support. You're charging me for ALS level support that I did not get. That's the way I would handle it. And I would argue that with copies to not just ambulance service, but also their billing department. And like I said, the state's Department of Health. And at this point, this person got the media involved. Kaiser Health News, their journalists got involved. Great. It shines a light on issues that they hope stay in the dark, in terms of inappropriate, billing practices. That's just straight up, just whatever the market will bear. And if you'll fall for it, 99% of the time people fall for it. The American public falls for it because we don't know any better. We're crushed medical debt nation members. We know better. And we're going to pay for the care we received, but we're not going to get gouged, and we're not going to risk our financial future or that of our families.